us asking students if they have any awareness of Alzheimer's disease. So join us as we ask. Good evening. And you mind if I ask you a question?
Oh no.
I'm Morgan with FTCC Network, and we're trying to raise awareness for Alzheimer's. Do you know how many people are affected in the U.S. by Alzheimer's?
Maybe 5,000?
Good guess. Tomorrow we're going to be talking about it on FTCC, so join us and you'll find out the answer.
Okay.
Thank you.
Thank you.
Excuse me, miss. Do you mind if I ask you a question?
Sure.
I'm Morgan with FTCC Network, and we're trying to raise awareness for Alzheimer's. So I was going to ask you, do you know any treatment options that are associated with Alzheimer's? Okay, well tomorrow we're going to be talking about it on FTCC, so join us and find out, okay? Excuse me, miss.
Yes.
Hi, I'm working with FTCC Network. We're trying to raise awareness for Alzheimer's. Do you mind if I ask you a quick question?
No, that'll be fine.
Are you aware of the signs and symptoms associated with Alzheimer's disease?
I know people with Alzheimer's forget stuff, but no, not
Okay,
really.
so join us on FTCC Network, and we're going to go over all that so y'all will know the signs and symptoms, how many people are affected, and the treatment options.
Okay, sounds
Thank
good.
you. Good afternoon. I'm Morgan with FTCC Network. This week we've been trying to raise awareness for Alzheimer's disease. No one really knows about the core facts of this disease, and we walked around our campus asking some students just some questions about Alzheimer's just to see how much they know. So stay with us as me and my colleagues talk about some things about Alzheimer's that may answer a few questions that you're not sure of. Our hope is that we make people more aware of this disease. So, Alzheimer's disease is a cortical pathology that affects 4.1 million individuals in the United States. 13% of these individuals are over the age 65, and roughly 50% are over the age of 85. So, Alzheimer's is the most expensive disease in the United States. It normally costs families around $200 billion annually. A lot of it deals with the long-term care that's involved with this disease. Individuals who have Alzheimer's are a diverse population, but it is twice as common in men as it is in women. Some things that may be impaired for individuals with Alzheimer's disease is memory, language, visuospatial skills, caused by a tiny change in the neurons of the cerebral cortex. So now I'm going to jump over to Madison so she can explain the signs and symptoms of Alzheimer's, and then after her we're going to hear Andrea explain the treatment and prognosis of it.
Thank you, Morgan. Some diagnostic information when it comes to diagnosing Alzheimer's include things like brain scans. This may be things like CT scans, MRIs, PET scans. Psychiatric evaluation is done. This would be explaining your symptoms to your doctor. Your doctor may provide memory thinking tests. Family members can come in and provide input. Doctors will ask about your well-being, about other relationships. Blood tests would be done to rule out other diseases that may be causing the same symptoms so that your doctor can narrow down your specific symptoms and rule out anything else. In rare cases, and usually clinical settings, clinical trials, genetic testing is done to diagnose Alzheimer's. Symptoms for Alzheimer's include things like mental decline, difficulty thinking and understanding, disorientation, forgetfulness, mood swings. In severe cases, aggression can occur. For lesions on the brain for Alzheimer's, these would be in specific areas. That would be hippocampus, medial temporal lobe, and cerebral cortex. Causes of Alzheimer's are not definitive. There's kind of a combination of things. It could be environmental factors, things like stress, smoking, diet, lack of exercise, workplace exposures, and it also has been linked to genetics. So I hope this provides a little bit more information, and I'm going to turn it over to Andrea, and she's going to explain more of this disease. Thank you.
The prognosis of Alzheimer's is generally poor. Eventually, Alzheimer's affects most areas of your brain. thinking, memory, language, your personality, and movement can all be affected by this disease. According to Mayo Clinic, the rate of progression for Alzheimer's disease varies greatly. On average, people with Alzheimer's live between 3 and 11 years after diagnosis, but some people may live 20 years or more. Factors such as the degree of impairment at diagnosis and untreated vascular risks such as hypertension are associated with a faster rate of progression and can affect life expectancy. There is no known cure for Alzheimer's, but according to Alzheimer's.org, there are two pharmacological approaches for treatment. One way slows the disease progression. This can be done with anti-amyloid medications by removing beta amyloids from the brain to prevent plaque formation. And the second approach temporarily lessens cognitive symptoms such as memory and thinking with the use of glutamate regulators. While there is still much to learn about this disease, every small step in research brings us closer to better treatment.
This is Morgan again with FTCC Network. We hope we have made you more aware of some things about Alzheimer's and the information, including just some basic facts about what it is, the treatment and diagnosis, the signs and symptoms. So share with your family and friends, people that you may know that have a grandparent or somebody in their family that has Alzheimer's. Thanks for joining us and have a great night from all of us at FTCC Network.